nice to meet you here. During today's short lecture, I will explain to you briefly about our respiratory system, and also I will introduce two common respiratory problems which include asthma and COPD. So firstly, let's have a look about our breathing. Now, we know that we need to breathe in the fresh air every day to get the oxygen, and our body continuously needs oxygen to maintain the life and to produce the energy. Now, in the whole air, there are different types of gases. Around 21% of the air is the oxygen, and around 78% of the air is the nitrogen. Around another 1% of the air actually include other types of gases, such as the carbon dioxide. However, our body only needs oxygen to survive and to produce the energy for the body cells to use. So next, we're going to talk about the anatomy about the whole respiratory system and have a look about how the air travels from your mouth and nose and into the lung. Now, when you breathe, actually the air first enters through your nose and your mouth and then reach the end of your throat, which is called the pharynx. And from pharynx, the air will then be further transmitted down into this big vent pipe, which is called the trachea. Trachea is very thick and has a wide space for the air to properly flow in. And then the air will further travel down through this trachea, and the trachea will be divided further into two big branches. Now, these two big branches go into your left and right lung, and this branch is called the bronchi. So the air will travel from trachea into bronchi, and then from bronchi, the big branch will then be further divided into smaller branches. And there are many smaller branches which are called the bronchioles. So bronchioles actually are much thinner and smaller than the bronchi. And at the end of the bronchioles, there are these smaller, there are these small air sacs. These air sacs look like a small ball, and they actually are called the alveoli. So they look like a different grapes actually attached to each other. Now this is our air sac, which is called the alveoli. And alveoli helps the gas to exchange. So when the air reaches the alveoli, the air will be exchanged. So oxygen will be reserved by the alveoli, and then carbon dioxide will be eliminated. Now there are very thin blood vessels actually covers around the alveoli, and these blood vessels is called the capillaries. And the oxygen will then be absorbed into the blood through these capillaries, and then the carbon dioxide, which is a waste product after you breathe, will be transmitted from the capillaries into the alveoli, and then will be breathed out from your lung. So that's why we breathe in the oxygen and we breathe out the carbon dioxide. And carbon dioxide is a waste product after your body consumed the oxygen. Now, then, so that's the whole process. Now, and at the bottom of the lung, we know that our lung stays in the chest cavity. Now, at the lower part of the lung, we have this big muscle. Now, this big muscle, we call it the diaphragm. Diaphragm actually can go upwards and downwards to help the lung to expand, to change the size. So when you actually inhale the air, the diaphragm, this muscle actually will move downwards. So the space of the lung will increase. There are more space in the lung, and then the air, so the pressure inside the lung will be lower than the atmosphere pressure, and then the air will be flow into the lung. And when you exhale, when you breathe out, actually the diaphragm actually will move upwards. So the lung space will be smaller, and then the pressure inside the lung will be higher than the pressure in the atmosphere, and then the air will be squeezed out from the lung, and then you will breathe out the air. So the diaphragm actually helps your lung to move and to change the size to help you to inhale air and also exhale, maintain this whole respiration cycles. So let's then further talk about these two respiratory problems. The first one is asthma. So what is asthma? Asthma is actually an airway allergy. So for some certain people, actually their airway is very sensitive. When they breathe in certain things such as dust, such as pollen, or some things in the air, when they breathe in these irritant things or the polluted air, now their airway, because the airway is extremely sensitive and very hyperactive, so that when these things actually travels down into the airway, now it will make the airway become really inflamed and produce excessive amount of the mucus. And also the airway will also become very constricted and narrowed. So it can block the airway and make patients feel very difficult to breathe. So asthma is actually a long-term airway inflammation caused by the hypersensitivity of the airway and the airway allergy. So we know that most people actually are not allergic to anything, but some certain people, they could be allergic. Their airway is very sensitive. So naturally, they are different with other people, with most people. And it is also related to our immunity. Now, for certain types of people, their immunity actually also is works in the exaggerated way. So when they breathe in something that their body does not like, their immunity will work very hard to try to get rid of that irritant which they breathe, and then will send a lot of white blood cells to that airways to fight against the irritant, and then it will make the airway to produce a lot of mucus, and also the airway will become narrowed, inflamed and swollen and red, so the patient could not breathe in the air properly. What things actually cause the asthma? Actually, it is really highly related to the genetic factors. So if someone has a family member or have a few different family members all have asthma, then this person have higher possibility to develop asthma in their later life. So it's related to the gene. And also the environmental factors could trigger asthma as well. For example, the polluted air, for example, smoking. Because when the dust or the polluted air actually travels through your airway, if your airway is sensitive and cannot cope with irritants, then the airway will become inflamed, and then your immunity will start to work to get rid of the irritants, and then triggers you have the serious inflammatory response. And then when the airway becomes inflamed, the airway will produce a lot of mucus and block the airway, and the airway will also become really narrowed and swollen, so the air could not flow in. So if you have asthma, patients will feel really short of breath, and then we need to give some medications called the bronchodilator. Bronchodilator actually can dilate the bronchi, dilate the airway, make the air make the air much easier to flow in through the airway. So it will dilate the airway, which is called the bronchodilator. So normally bronchodilator is designed like a puffer, as a puffer. So the patient breathe in this puffer, and the powders inside the puffer will be spread into the airway to help the airway to dilate, to become wider, so the air could flow in. Another problem is called the COPD. COPD's full name is chronic obstructive pulmonary disease. Now, this condition is mostly caused by smoking. If patients smoke for many years, now they dust from the cigarette contains a lot of toxins. Now, these things, the smoke, when they flow into the airway and the lung, it will make the airway continuously get inflamed. So the body's immunity try very hard to eliminate these toxins and the irritants from the cigarette. However, people like continuously to smoke, so these things cannot be eliminated and always stay in the area and always make the airway to be inflamed. So continuously the airway is inflamed and become really swollen, become narrowed, and patients also, the airway also continuously produce large amount of mucus, and this mucus could block the airway. So COPD patient is a chronic condition normally caused by smoking. There are two main types of COPD. One type is called the bronchitis. Now, bronchitis is the inflammation of the bronchi and bronchioles. It's a chronic inflammation of the bronchi. Another type of COPD is called the emphysema. Emphysema is related to the damage of the alveoli. So when the alveoli is damaged or is distracted, it is called the emphysema. The reason is also because of smoking. Now, when people smoke, the toxins and the irritants from the cigarette can damage the alveoli in the long term. And when the alveoli is distracted, is damaged, it could not properly exchange the air that we breathe in and could not properly reserve the oxygen for the body to use. So with COPD patients, the most important thing is to quit smoking and also use bronchodilator, and also considering have the continuous delivery of the oxygen, so maintain good oxygen supply. COPD patients normally need to have 1 to 4 liters of oxygen continuously, so always maintain good amount of oxygen in the lung. Because the alveoli is not working, or the bronchi actually is blocked and produce too much mucus. So I hope this small lecture could help you to understand a little bit more about our respiratory system and about these two common conditions. Thank you.